Welcome everyone. Very good afternoon. I welcome you all to the SHRM webinar. On the topic for the webinar today is the road ahead, embracing a hybrid model and lessons for the healthcare industry. We are doing this webinar in partnership with Randstad India, a wholly owned subsidiary of Randstad Holding, global provider of HR services. I'm your facilitator for the session today. My name is Saurabh, and I'm a senior knowledge advisor at SHRM India. Now, before I go and introduce the speakers for today, a few pointers for the audience who are already here. The primary mode of interaction for today's session will be through the chat window. So please feel free to share your views there. Feel free to ask us questions. You can shoot it to the panel members also. I will ensure that they are getting addressed during the Q&A sessions today. And we have two Q&A that we have planned for the sessions today. I'll also take a moment now to introduce our panel. So we have Mr. Paul, who is the MD and CEO of Randstad India. He's also the moderator for the session today. We have Dr. Sanjay Arora, who is a MD and founder of Suburban Diagnostics. And then Mr. Neeraj Balani, he's the MD of International SOS India. Without further ado, I'd like to invite Mr. Paul to take over the session as a moderator.
Thank you, Saurabh. Thank you, Saurabh, and thank you to SHRM for partnering with us here at Randstad on this very important discussion. Greetings, everyone, from Bangalore. It's a special day for us at Randstad. 349 days ago, we put locks on our doors across all of our offices across India. And today we open up the locks. In fact, we cut a ribbon ceremoniously as we reopen our offices today. It's a sign of stepping in the right direction. We look forward to opening all of our offices across the country. Thank you. Today is a discussion about something extremely important. It's about people. It's about health, it's about safety, and it's about wellness. And we're going to learn from some leaders who have very interesting perspectives. Both Sanjay and Neeraj come to us with unique viewpoints and perspectives, and I would say stories from the front, side, and middle of what's happened in the past 1 year. But before we get into that, I want to kind of identify a few things that have come to mind over the past year. And we've heard a lot of words like pandemic, crisis, unprecedented, ambiguity, adversity. We've also heard of words like agility, resilience, hope, optimism, teamwork, togetherness, compassion, empathy. I think the second group of words I used outweigh the first group, and that's what's gotten us through this crisis. And I do believe with crisis comes opportunity. We've seen it all around, not only in India, but across the world, and certainly working for a global company like Randstad. We have a footprint across the world, and we see what's happened through the crisis, how teams have come together, how people have come together, how employees now extend relationships into families and beyond. We've really become borderless in a way, thanks to this crisis. Now, when we talk about healthcare, nothing is more important right now than wellness, both physical and mental and emotional. And so today we're going to talk about that. We're going to address how healthcare is evolving in India, particularly ignited and instigated by this crisis. Certainly recently, there's been the release of the new budget in India, which is a hot topic, the investment in healthcare. There's also lots of talk about how digitization of healthcare is coming to the forefront, again, pushed forward because of COVID, whether it's AI, machine learning, we talk about online consultations and so on. A lot of things that we hadn't considered in the past are now becoming the new normal. And I would argue that instead of using the word the new normal, we should start talking about the new world, because we are moving in a new world, and certainly healthcare is no exception. On that note, let's get right to it. Looking forward to having a great conversation today. And I'm going to start off with the first question for Neeraj. Neeraj, welcome. Thank you for joining us today.
Good afternoon, everyone.
Hi. So Neeraj, International SOS, very interesting organization, and it'd be great if you could share a bit about International SOS. I think many people on the call will know you, but some maybe not. But you're in the business of, I would say, saving and protecting lives. Quite a unique combination, actually. Protecting the global workforce from what we're seeing right now, health threats, pandemic, security threats, and so on. I'm very interested to know also how your organization has handled this, considering you're in the middle and your mission is to protect people when they need the most protection. And how did you handle this as a leader? And what have you seen in terms of how you've driven your organization, steered it, perhaps some of the outcomes from that, resilience and so on? Over to you, Neeraj.
Thanks, Paul. And as you rightly mentioned, International SOS operates a global assistance platform for organizations and help them protect their employees from medical and non-medical risks. And not only we operate an assistance platform globally, we operate over 1,000 clinics in remote locations as well as large IT campuses across the world, where we run a big health and wellness agenda for our customers to build organization resilience for the last 35 odd years. I remember as the pandemic broke out into India last year, as you were mentioning, the 349-day count. It was March 23rd, I guess. I remember distinctly, and of course, I was in office for a few more days to close on some very important last-minute preparations. But I think in spite of we as an organization having seen the pandemic early on in China, towards the end of the year last year in 2019, we'd already started preparing for a hit on our operations due to the forthcoming lockdown restraints. Our medical staff had to be prepared for a long haul on customer duty, plus some of our teams were called in by the government for compulsory rotational duty, which all of our teams proudly managed to deliver. While of course the non-protected, the non-medical staff had to be protected like everybody else, in terms of these crises. And I think from March last year, 2020, till about November, it was a roller coaster for our teams. From handling over 3x calls for help and ensuring that 5,000 plus network of our hospitals and service providers is updated practically on a daily basis. And I'm talking the challenges we faced in India as a team, day in and day out, because the government and was rolling out infrastructure in terms of the testing facilities and isolation facilities on a daily basis. We had to make sure that we are updated at the highest levels. And I think every member in International SOS was burning midnight oil at that point of time. And all this, which we were supposed to do from the new normal of work from home. We were advising suddenly over 100 different CEOs across India and some schools in India in terms of how to start taking a look at their own organizations, look at how they would want to reshape it and start building an overall resilience against this pandemic. And I think if I come to your question in terms of the changes, I would definitely say that a lot had to be done in terms of our processes, the IT, network, hardware, software, collaboration, the run of the mill that you would actually want to do in a crisis like this when we are suddenly forced to change the model of operation. But I think the biggest investment, if I had to pull out, was the way we had to reshape our people. It's very difficult. That you have a running train, and of course suddenly when you have to make a 90-degree turn on that running train, it's a very painful change management for people. And I think it becomes very important because at the end of the day, the way our employees deliver can end up saving somebody's life. So we had to do it, but we also had to do it in a very reliable manner. And I think we leaned back on our core values of passion, expertise, respect, and care, to drive this change through. I remember if I had to just list down the top 2 or 3 which come to my mind, I think we strived right from the beginning as we started our preparation to start affecting a larger transparency and agility in our internal processes. And what do I mean by that? See, as an international SOS assistance company, we are working with a huge network. Our employees are catering to a large number of customers who call in our centers. Everything is auditable because we provide our services on IT platform. And I think as we take a look at all the paperwork that is generated, the permissions from authorities, assistance on ground, And like I said, all these are subject to heavy audits in post facto. And suddenly moving onto a a paperless kind of an environment, we had to make sure that we start putting in a lot of transparency in terms of the way we work within our teams as well as our partners in our ecosystem. So I think that was the starting point in terms of making people accept that there is going to be a change in the way we start doing things.
Thanks, Neeraj. And I think what you see there too is also that you went from your version of business as usual, which is protecting those who needed protection, both in terms of health and security, but also when the pandemic hit, you were suddenly flooded with everyone who had questions around what's next. And of course, when you don't have all the answers, that's a tough situation to be in. But how did your team handle that? Not having the answers, how did they address that?
No, excellent. I think thanks for driving that, Paul, which is what I was coming to the next point. That as we ensured that our first sermon was to drive transparency and agility into the entire ecosystem, right from our partners to our customers. I think we started ensuring that with this as a principle, we started giving more and more responsibilities to each of our employees, and I think that's where the entire team started responding very well, whether it be talking to our customers, whether it be telling them that, hey, we are flooded with calls, maybe we'll take a slightly longer time to respond. And I think finally, at the end of the day, what was appreciated by the ecosystem, whether it be our customers, our partners, I think is the care with which we started doing this. So not only we held on to our processes, the rigidity at times that we have to follow, but we also made sure that a lot of human touch with complete transparency and agility was also induced into the way we work across teams, so that people started understanding the way we would respond. And even our employees were able to make sure that the switch that they had to take a look at with respect to increased call volumes, with the change in environment, they were much more comfortable in accepting large responsibility at a higher call volume rate. And I think that is how we managed to make sure that the change was delivered.
Yeah, Neeraj, you raised a good point. And one of the lessons I learned, and I'd like to hear from Sanjay in a moment, as a leader of a large organization with 62,000 people here in India with Randstad, sometimes the leader doesn't have all the answers, especially in the middle of adversity and ambiguity. And it's important to be honest and human and transparent when we don't know, but we also need to reassure our teams and our customers, in your case, that we will find the answers. And when we have the answers, we will get them to you. I think it's very important to be honest, but also to assure that there will be action. So thank you for that, Neeraj. Let's move on to Dr. Sanjay. Well, Sanjay, Suburban Diagnostics has been in the center of this at the absolute front end. And I know you and I have spoken since, when the pandemic hit and onwards. And we've kind of been learning from your journey as well. I think it'd be good if you could share with our listeners a bit about Suburban Diagnostics, perhaps what you did before COVID and what you've been doing during, because
Sure.
It's quite a story. But I wanted to also add on this question, and you can talk about this as well, India is leading the way globally on vaccine manufacturing. In fact, we could even argue that India has a surplus where many countries are just barely able to get enough to kind of get the pace going. And India is even donating some to some countries, I think 17 countries and counting, coming under the theme of a new word, COVID diplomacy, something we hadn't heard before, which is a separate topic. But with that in mind, there are different schools of thought about vaccines as well. Some are eager to get it, and some are not. Some are concerned. And of course, there's misinformation out there and so on. So of course, as a doctor, we'd like to hear your thoughts on the concept of the vaccine, but also, again, a little bit about your story and from then to today.
Well, thank you, Paul. Thank you for setting context, and thank you for Neeraj to, elaborate on that. I like the way you introduced, the few words that you described right in the beginning about the challenges, but you also ended with few words that, resonated hope and, a positive outcome. One big word that I felt was an opportunity was purpose. And I felt the healthcare industry overall globally was connected with this common sense of purpose. And I think nothing connects any team better than a sense of purpose. And I saw this live over the last 12 months, where everyone wanted to contribute. I don't think there was a single person in my team who said, I don't want to be a part of this. Despite knowing the risks, despite knowing the challenges, everyone put their hand up. In fact, on day one, when the lockdown was announced and there was an opportunity for healthcare workers to travel, 90% of my team was actually on the job. So that's what I'm maximally proud of, that we were able to connect the team on a sense of purpose. Everyone wanted to contribute. And I like that, question you posed about the leader does not know everything. And that's what we did. We brought in a concept called inclusive leadership. I have practiced this over the last 27 years since my wife and I co-founded this organization. And we have never seen the importance that diagnostics has got as it has this time. Testing has been an integral part of managing this pandemic. You track, you test, and then you manage. Everything depends on testing. And we are a testing company. We are a company that does lab tests for the last 27 years. And we finally find that diagnostics has finally got its importance and its respect under the sun, because we know that diagnostic accounts for about 70% of medical decision making at less than 10% of the overall cost. And if you ask anyone today, everyone on this planet knows what an RT-PCR test is. It's not a very common test. People know what blood glucose is or cholesterol is, but RT-PCR, I mean, it's not a common, word. But today, everyone on this planet knows that test. And I think diagnostics finally has been able to make that impact. And I feel extremely proud and privileged to be part of the diagnostics industry and to be part of the healthcare industry, that where maximum the world was at the receiving end, we had this opportunity to contribute and to make a difference. And to put this into context, we did our first test on 24th March 2020. And why I remember that date is because that's my birthday. And my team always told me that you wanted a gift, a super gift on your birthday, and here it is. We have done the first COVID test on your birthday. And I remember, Paul, we did few hundred tests on that day. We peaked at over 5,000 tests a day. In fact, we peaked again last week over 5,000 tests.
Wow.
And collectively, the PCR tests, the antibody tests, and the antigen tests, we feel we should be at 1 million tests by March 24th this year. So that's the kind of, we've been able to impact, I would say, 1 million families and 1 million lives. And that's the feeling of pride that, both our team and myself feel in being able to contribute to this pandemic. So that's, I guess, just to set context about what Suburban Diagnostics did. And let me answer your question about vaccination in a slightly different way. We are a healthcare company, and we were obviously in the line of fire, as a result of which we were also the privileged ones to be given the vaccine right on day one. So on 16th of January, our lab director was one of the first persons in the country. She took the vaccine on the first day itself. Up close and personal, my father, who's the chairman of the company, he is 85 years old. He has been vaccinated. I am almost 55. I have been vaccinated. My wife is 53. She has been vaccinated. My daughter is 27. She has been vaccinated. And a younger daughter who is working in Tata Hospital, it's a large oncology hospital in Mumbai, she has been vaccinated. So just to put everybody's mind at ease, from an age of 25 to the age of 85, I have seen it up close and personal in my family. And I want to reassure everyone, we are all doing well. In fact, many of my friends, many of our colleagues have gone ahead and taken a second dose. We have a very senior doctor in my team who's in his mid 60s. He has taken even the second dose, and I met him just 10 minutes ago. So just to reassure people, there isn't anything to fear. And I do understand, people feel that how did a vaccine get developed so quickly when in the past it has taken years, maybe 10, 15 years. Some vaccines were developed in under 5 years, but nothing as quick as this. But people also have to understand how medical science has progressed. It used to take years and it used to cost a lot to get the genetic code of a particular organism. The virus was identified in December of 2019, and in Jan of 2020, we knew the full genetic code of the virus. And that, according to me, Paul, paved the way for the vaccine development to happen much more quickly. Because we had the genetic code within a month, we knew exactly what we had to target, what kind of proteins were there, how do we, encode those proteins. In fact, there's a lot of questions about the vaccines that are developed in the US, the mRNA vaccines. That's a technology that was waiting to happen. And in fact, the success of the COVID vaccine will allow a lot more vaccines to be developed for dengue, for malaria, and that will all happen on this mRNA technology. Up close at home, the technology is being used in India, whether it's the Covishield or the Covaxin. Covaxin, in fact, is the most tried and tested technology of a live attenuated vaccine. So in fact, it's the most safest technology being used to develop a vaccine. Covishield is somewhere in between where mRNA is and the live attenuated is. But the fact is that it's being developed by Serum Institute. I spoke to the medical director of Serum Institute. He conducted a webinar for us in December last year, and I continue to be in touch with him. I have friends who are responsible for the trials of the vaccinations at various sites across the country. No one has reported an adverse reaction of a kind where we would be afraid to take the vaccine. It's extremely safe. I understand people have this apprehension, but between not taking the vaccine and taking the vaccine, please take the vaccine. I have done it myself. My family has done it. My team has done it. My friends, my colleagues. The data that is coming from across the world is more and more encouraging. There will be a mild reaction the day you take the vaccine or the day after that of a slight fever or a body ache, which happens with almost any vaccination that you would have taken as a child. But I would encourage, once the vaccine becomes available, please go ahead and take the vaccine.
Thank you, Sanjay, for that. Real stories backed by science as well. If I can share a real story, not backed by science, because I'm not a doctor and not a scientist, but I have two brothers in Canada. One is a police officer, one's a firefighter, essential services, and both their wives are nurses. One is a care worker in a retirement home, a nursing home, which is high priority and critical, and one is in a hospital. All have had both doses of the vaccine and different versions of the vaccine in North America being used in Canada, and both experienced what you just described. Slight side effects, a slight fever for a day or two, but back. And they all sort of took the same stance that those side effects are much better than getting COVID itself. And that's the general consensus in their communities as well. So again, for what it's worth, that's what I know. Believe me, I'm ready to register for the vaccine here in India as well. As soon as I'm in the, I guess the next phase, I should be included as well.
Yes.
And I'm encouraged by Neeraj and your, Dr. Sanjay's story about how your teams came together in the midst of crisis. That's a real affirmation of your purpose, as you spoke, Sanjay, as well. I'm an absolute believer that this crisis has woken us up to the importance of purpose, and every leader I speak to now has taken purpose from maybe third or fourth on their priority list to by far number one, along with compassion and empathy. So thank you so much for that. I understand we have lots of questions. They're piling up, actually, Saurabh. So I'm going to bounce it back to you, and perhaps you could go into some of the questions from our audience. I think you're on mute there, Saurabh. You just need to unmute.
Thank you, Paul. I do have a question here. I believe it's for Dr. Sanjay. The question is from Pooja. Is it true that people are having COVID again post-vaccination?
Excellent question, Pooja. In fact, we had a case in our office just last week where, despite taking the vaccine, the individual did test COVID positive. So what the vaccine does is it reduces the intensity. So there are two parts to the whole process. It's the coronavirus and COVID-19. COVID-19 is the outcome of an infection with the virus. So what the vaccine currently does is it does not prevent getting infected from the virus. What it does do is prevent the COVID-19 symptoms to appear or the severity of the disease. So even if you had COVID, it would be very mild. So you can get infected even after you take the vaccine, but the intensity of the illness will be negligible or minimal, or you may not even know that you have it. So that's the benefit at this point of time of taking the vaccine. And eventually, when more and more people take the vaccine, it will impact the transmission as well. And we know that once you start transmitting the virus, that's when the virus gets a chance to mutate or change its structure. As the transmission goes down, the mutations also will go down. So that's why it's important that we more and more people get vaccinated. The intensity of the disease will come down, and eventually transmission will also come down. But great question. That's why even after you take the vaccine, you still need to wear a mask.
Thank you, Dr. Sanjay. Uh, Another question which I have is for Neeraj. The question is, healthcare workers have always been at the forefront, and now we are worrying about the parallel pandemic of burnout and mental fatigue. What measures is the industry taking to help their workforce? Neeraj, over to you.
Thanks, Saurabh. And again, it's a fact which has now been discussed over the last 6 to 8 months, and it's a reality. It's not only the fatigue which is overpowering the health workers in the front line, but also if you take a look at other industries, because of the big change and the change of first being isolated at home. In the early part of the pandemic, when it hit India and even elsewhere in the world, where people were in a lockdown, but still continued to live by their lives, not only performing their daily duties, but also performing various roles at home, either of being a caretaker or a caregiver. So yes, this is something which I think will worsen as a condition. People are fatigued across various aspects, either be it professional or personal life. And I think the first that we advise our customers is recognition, of this issue to the forefront. In all our customer engagements, when we talk to them, we encourage organizations to develop programs wherein employees are encouraged to come forward with these issues, especially in a country like India. Mental resilience, if I may use that as a terminology, is still considered a taboo. I mean, if you go and ask somebody for help on a physical injury, it's normal. Moment when in India you go and talk to somebody about a mental condition or something which is troubling you emotionally, it is considered still as a taboo, even in the well-versed circles. So I think the first thing first is change at the management level within organizations to start accepting that this is something which is normal, which can affect anybody, including myself. And the second is to create platforms within organizations so that employees can come forward and talk about it. And of course, once the nature of the problem is in the fore, is being able to be spoken about by the employee, then of course there are multiple ways through which we can seek professional guidance or medical advice to actually help employees overcome these. And again, I think in the last, I would say, like I said, in the last 6 to 8 months, there have been so many cases that we've been able to handle where people have to go through so much of these issues where a professional help can do wonders. This case is very fresh in my mind that we had a very old person who underwent an operation. I think this was somewhere in November. And while he went through an operation which was to correct a physical deformity in one of his limbs, I think because of the restrictions of the lockdown and because of the severe restrictions of clampdown in terms of how he could go ahead with the physiotherapy, the person actually went through a mental crisis wherein he started believing that he couldn't be cured after the operation. And because we were able to identify that as an issue early on, after he was in his post-recovery, surgery recovery, we were able to get a professional guidance, understand, work along with him over Zoom calls in a 2-week period. And the good part is the gentleman within a month's time started believing in some of the shortcomings that were in his mind, started walking with the help of proper physiotherapy once he started accepting, the realities in what the challenges he was facing. So of course, a big problem. The idea is that how do we create the right change with the leaders so that they start accepting it, and platforms for employees so that they can come forward and start expressing this.
So thank you, Neeraj. Saurabh, I'd just like to add a comment from my perspective. Leading a large organization, we also discovered very quickly, the first response, default response was last March, let's make sure our people are safe, connected, engaged. And then our engagement activities were all around fitness, physical fitness. So leaders were creating short videos to send to the team, say, hey, it's my fitness routine, let's do it together, that sort of thing. But then we also quickly realized that this was going to be a marathon, not a sprint, and that we needed to shift into supporting our team in their mental and emotional health. So we partnered with an organization, an EAP organization called Your Dost, your friend. And they're a wonderful organization in India that has grown with us and learned with us. We then extended it out. We realized that it's not just about the employees. So all of you who are listening, you think about your teams. It's not just about the employees, but it's about the families in the homes. So we extended this service to the families of our employees. And then we took it one step further to the rest of the families and all of our contractual workers, 62,000 workers. The usage of this service has been off the charts. So to your point, Neeraj, well, on one hand, maybe India is not culturally not somewhere where people would, be openly speak about this. They're happy to pick up a call or a phone and have a confidential call with someone. And sometimes that's all you need. And I'm very pleased that we're able to offer this. And many organizations that we support are also offering this similar kind of service. So I highly recommend it. A lot of people are suffering from anxiety and loneliness and fear and so on. And just sometimes having somebody to talk to is needed. So I really recommend it. Thanks, Neeraj. Saurabh, back to you.
Paul, if you could share the link of this site for everyone, I think it'll be useful.
Happy to. Your Dost. Yeah, we'll share it before we're done.
Your Dost. Okay, thank you.
Yeah.
So Paul, in this session, we had parked 5 minutes for Q&A, so we can continue, and then again, we'll come back to the audience questions.
Okay, well, let's move on to the next topic. Great conversation so far, and I've got my eyes on the comments as well, and thank you for your responses. And some are not questions, they're simply comments, and we appreciate that you're getting something out of this webinar, and that's why we're here. Let's move on to the next topic. An observation. What has happened? I mentioned earlier about crisis brings opportunity. Well, in India, let alone the rest of the world, but certainly in India, the larger hospitals, the brand name hospitals, if you will, in India, have all quickly shifted to an AI/online model. Telemedicine is a term that wasn't used much before, but it's being used more than ever. In fact, latest data that I've seen shows that 80% of doctor-patient consultations, particularly in the past 10 to 12 months, have been happening online. So, let's say before COVID, it was almost unthinkable to do it online unless you lived in a very remote area where you didn't have access to healthcare. But now it's quite common for people to meet with a doctor in a virtual forum, in an online forum, or even in a phone call or WhatsApp and so on. So this is interesting. It provides opportunity. I'll go back to my comment earlier about opportunity, the opportunity for technology, again, AI, machine learning, and so on, to play a role in the future of healthcare, particularly in India. And then that brings some implications. For example, skills required for the future world of healthcare in India, and perhaps which skills are missing, which skills are required. And if we talk about how we're going to get there, the upskilling and reskilling of healthcare workers. Keen to hear both of your thoughts on this. And I'll start the first question with Dr. Sanjay. Investment in healthcare in India has been quite phenomenal. I mean, the growth of healthcare, it's no surprise in India being the fastest growing population, on average, the youngest population, only getting younger as it grows. And certainly GDP is slated to bounce back according to the World Bank. There's a strong need for robust healthcare and so on. When you talk about the investment in healthcare alone in India, how does that translate in your view to skilling and also the demand gap in the industry, getting the right people? And any ideas on how we can fill this gap in India?
Great question, Paul. And I think, healthcare has seen investments for the right reasons. There's a huge gap between demand and supply in the healthcare ecosystem in India. That we see that there is a rising population. We see longevity; people are living longer. But at the same time, we still see there is less than one doctor for 1,000 population and less than one hospital bed for 1,000 population. We also find that the middle class is, increasing in its ability to spend, is getting, upwardly mobile, but yet there's a huge gap in the skill sets available for delivering quality healthcare. So that's the gap, between demand and supply. So while the investments have largely come towards enhancing the infrastructure, I don't see as many investments coming in towards bridging the skilling gap. And I'll just again share my own experience of what we have done. Uh, about 6 years ago, we started our own paramedical training institute. The idea was that how do we get people who are job ready, so that as we keep expanding our network, we get people, we curate a program which allows people to get job ready. While initially it was started as an opportunity only for Suburban Diagnostics, today it's taken a much larger shape. And we are seeing so much of demand coming from different sectors of healthcare. So just to put that into perspective, Paul, that for every doctor, you need 9 paramedical staff. That's the need, 1:9. So every new doctor that comes into the industry needs a support of 9 paramedical staff. In my organization, we have a little over 1,000 people. We have close to 100 doctors, but the remaining 900 are non-doctors, but part of the medical ecosystem. And that same ratio you would see in any large hospital or any large healthcare ecosystem. So I guess the opportunity today is to see how do we bridge this gap in the paramedical skilling area, whether it's somebody who's coming to your house to do a blood test, whether it's an X-ray technician, whether it's a nurse, whether it's a dialysis technician, whether it's a physiotherapy technician. There is so much of support that healthcare requires from that. And I guess that's the big opportunity. We have started our journey. There are a few other companies that have started in this. The Ayushman Bharat scheme, which is a very ambitious project of setting up 150,000 primary healthcare facilities across the country. But each of them will need to be manned with skilled healthcare professionals. And that, I guess, is the opportunity that is there. So there are few companies like ours that have started looking at doing backward integration and trying to provide for that. But I guess we need to have the government to look at this a little more closely. I guess success of education platforms like Upgrad and Byju's, will propel the digitization of this as well. So there is a huge opportunity on how we can use technology to, bring in that kind of quality education, standardization, and then create a network where we can also upskill. So I guess that's the gap, but that's also, I believe, a big opportunity from my perspective.
Yeah, thank you. Great insights. And, I think about the term healthcare, and this leads into the question for Neeraj as well. We talk about care. Technology can't provide care. If we talk about compassion and empathy, it's pretty hard. I've never met anyone that would finally decided to make an important purchase or to make an important life decision thanks to a chatbot. That's just one touch point, right? And so we need to be careful not to attempt to have technology replace the touch, the human touch, and that's what you commented on as well. Thank you. Neeraj, the situation continues to evolve about return to offices. We are a living example right here in Bangalore. We just reopened our Randstad Tower here in downtown Bangalore today after 349 days. How can organizations, however, fulfill the duty of care? This term duty of care is very important, powerful, especially moving forward, because organizations, not just the medical profession, healthcare industry, but we're talking about organizations like ours, we have a duty of care. We have a duty of ensuring that our workplaces are safe, that our people are taken care of and working in a safe environment, physically, mentally, emotionally, and so on. What are your thoughts on this?
Sure, Paul. I think that's a great question. And, now that you asked me, there's something very interesting which I read last week in the Times of India. I think Mumbai opened up a couple of weeks back. And last week, there was a very interesting article that the authorities in Mumbai had fined 23 lakh people in one day for not wearing a mask. This was last week. Now, can you imagine? And the authorities are finding these people on the Mumbai roads without the mask. And I was thinking, who are these people on the roads? I'm sure they are office goers. I'm sure they have access to the mask, probably free from the organizations. They have learned, they've been spoken to by their leaders in terms of taking the right care. What does this tell you? That change is still very difficult to achieve. And maybe if I take two steps back, how are we going about building our workforce resilience or our duty of care or the larger change that we would want to drive into our employees and nudge them to take care of themselves? And I think this is where I always say that when we build the right resilience program for employees, let's start with recognizing our employees. Let's understand how would we help them participate in the same rather than trying to start from a very different aspect, which is, hey, what is our insurance program and what does it include and not include? That's the wrong street, to travel to. I remember when we started the 19 resilience program within the organization, I was fortunate I had the access to the brightest, set of medical professionals globally who gave us a good insight into the virility, vitality of the virus, patterns, consequences, and so on and so forth. And early on, I recognized that the biggest difference against the virus for any employee is the employee herself. If basic things were done by the employees, we encourage temperature checks twice a day, masks every time when you step outside your house. The chances is that you'll either be less affected or you'll escape being infected by the coronavirus. And I think just to drive this change, we started an employee check-in program every day, wherein a corona warrior from our company would actually call all our employees once a day to check on the temperature, whether the temperature has been taken, not only for the employee, but also the dependents, because you're living with them. And I remember the first couple of months, I used to actually get complaints from employees that why are we being checked upon every day? Some people actually found it irritating. And we persisted with it. And I'll tell you, sometimes even I used to feel, I'm in a meeting, I'm in a seminar like this, and suddenly my phone call goes on and the warrior wouldn't stop unless he would get hold of me. But I think today, a year later, it's my habit every day when I get up. The first time I open the door, I check my temperature. The first time I see my family member, I check their temperatures. Mask is at the door. Anytime you move out, wear the mask. Anybody who comes in to the house has to wear a mask, sanitize ourselves. And these are the changes which I think was ingrained in my brain, and I'm like any other human being, by the corona warrior. So today, while we have reduced the frequency of this small help, this check-in line to maybe twice a week, every time the phone doesn't come in, I get a bit impatient. Why am I not being checked up? And I think this is a big example of how you build something very non-intuitive, something which even people may find very irritating, but then goes a mile in terms of changing some behavior patterns in our very hardwired, ingrained brains. And I think that's the cornerstone, that we need to really think that for every resilience program that we build, start with the employee, understand them, see what changes, what's the value of investment that you would want from these programs that we take in, and then let's start designing from there. If I take a look at what we've been doing as our observations into our customers, since the lockdown, since the last 12 months on the resilience program, we've seen a lot of investments in ergonomic related resilience programs. People, as they work from home, they don't pay attention to the postures, screen times, which often at times leads to issues with joints, bad health because of a weight increase. We already discussed mental wellness. And these are some of the boxes which I thought are right examples in terms of how we observe the patterns complaints coming in when the employees call us for help, and then taking the data, we do the analysis and come back with the right programs towards it. And again, I think, I won't belabor more on these points, but I think every needs to take a look at this in a serious manner. I would say get a professional to start taking a look at your employees, and then start from the beginning in terms of what's the right program for you. What's the right program for your organization, and what is the value of this investment that you would want to take a look at? And like I said, today, if I take a look at the resilience program in the rightest of way, you would want to think about not only a reactive platform for your employees to reach out to you, which is about consultation, or access to the right medical person, but you also would want to talk about the health and wellness thought process with an employee. I mean, how would you want to encourage them, nudge them to lead a healthy and a nice life? And I think this is where you need to start thinking about giving them proactive thought processes or nudges about inducing those practices in their lives. And with the right hooks, to behave or to entice the employee with respect to the participation. And I think this is a recipe which should be on top of every HR head's priority. That, hey, get an expert on board, think about what's the right design, think about value, and think about both the platforms, the proactive one, which helps you with the health and wellness, and the reactive, which helps your employees have an access to a professional medical advisor.
Thank you, Neeraj. And in fact, I'm glad you raised that. I'd like to offer something out, and I think, Bhuvana, you can share the link. We came together with direct competitors. First time in history, has never happened. We put our competitive hat aside and we sat down with Adecco and Manpower and GI Group in India and globally. And we came together with support from McKinsey and the World Employment Confederation. And we created some protocols around safely back to work. I would say safely back to the office, because we've never stopped working. It's an open source document, and we're going to share it with everyone here. And it has very detailed protocols based on CDC guidelines, WHO guidelines, and so on. We're happy to share it. And Bhuvana and team, if you can share that with the audience. Duty of care, for me, actually, listening to you talk, Neeraj, it's not limited to healthcare professionals. It's all of us. We all have a duty of care. As you said, by putting on our mask, we're actually honoring our duty of care. We're caring for one another. And that's the same right in the workplace and in the homes as well. Sanjay, you had your hand raised. Did you want to make a point?
Yeah, so I just wanted to maybe, just stretch myself on the limb a little bit here. We all speak about temperature monitoring, and we all check, some people even go to the extent of, having your finger checked in a pulse oximetry, done. I would like to know from people, how many people have actually found people with a raised temperature when they did that? I would practically say zero. So I think, Paul, you summarized it just before I came on, that I think the only thing that we need to stress upon is wearing a mask. That's it. I think this temperature checking perhaps is unnecessary, and definitely please don't invest in a pulse oximeter and get everyone to put their finger in it. Someone who's going to have fever is definitely not going to step out of the house anyways. And I have not found a single person who has been picked with that infrared thermometer on your forehead or on your arm. I don't think anyone has been able to find someone with an elevated temperature through that. So I guess just focus on having everybody wearing a mask, and we'll be okay. That's the message I wanted to share.
Thank you, Sanjay. And I think there's something about the human spirit that, we feel like if we're taking precautions physically by doing that we're taking a step in the right direction. It's an effort.
Sure.
But I will confess, we social distance and I follow all protocols. I occasionally visit a Starbucks not far from my home, which has great protocols in place, by the way. And I've come to know the security guard there at the entrance. And of course, takes a temperature. And I asked him the other day, have you ever had someone arrive here with a high fever, and did you turn that person away? And I was surprised to hear that, yes, sir, yesterday.
Oh, okay.
So for what it's worth, Sanjay, that's one experience I had.
Okay. No, good to know. Good to know
that it's not just going through the motions. Huh? So we're going to stay on this topic. Sanjay, actually a little bit slightly connected to the topic. I talked earlier about telemedicine, online consultation, and so on. I mean, you've been, and I say this with respect, Sanjay, you've been around a long time in let's say the healthcare industry, and you've seen it go from quite analog to where we are now, where suddenly, where people are embracing this idea of virtual consultations and so on. It also means, I guess, a bit of a hybrid work model for people in healthcare. I imagine doctors and healthcare professionals who have never, worked with patients in a virtual environment. This is new to them as well. What are you seeing? What are your thoughts on this moving forward?
Absolutely, Paul. The prediction is that 25% of consultations will eventually move online, and that's a huge volume. And you mentioned, you had statistics where said 80% of all consultations were happening online. And I've seen that with so many of my friends, so many of my colleagues who have actually started using technology and using online consultation. But recently, I also read a review from McKinsey, and I will share that with you. Maybe we can share it with the audience on how people in the US are now finding that also, they want to go back to that touch and feel, environment. So it started off really well. I think, people got used to this new online world. And I guess, at least in the US, we are seeing some sort of a decline. But in India, I think eventually there'll be a good balance between what can be managed at home, should be managed at home, and what needs to be managed in a hospital or a healthcare facility. Only that needs to come. I guess that's perhaps the biggest learning. And I guess this hybrid model is going to be extremely useful, uh, because in a city like Mumbai or Bangalore, accessibility can sometimes be a big challenge. And if we can bridge the gap on accessibility, if we can use technology to bridge accessibility, if we can get an Apple Watch to give you an ECG, and if someone's got chest pain, and if you have a smartwatch or a smart device that can actually take an ECG at home, transfer that data on the cloud to your physician, the quality of care that you would get would be significant. So the delay in coming to a diagnosis, all that would be, will be a thing of the past. So I think, Paul, we have adopted technology for the right reasons, and I believe that over the next 6 months to a year, this will see a very good balance between the online and the offline world. And I think it will actually, the way I call it, unburden the increased burden of people who come to the hospitals, so that only those genuine cases that need to go to a hospital or a healthcare facility will go there. Your basic things that can be managed remotely will get managed. So I guess it's going to be a great win-win situation for the patients or the consumers, as well as for the healthcare, already stretched healthcare ecosystem. Not to include how this will allow the semi-urban and the rural markets to get access to better quality healthcare. So I think overall, it's a great opportunity to create that hybrid model.
Great insights. Thank you, Sanjay. Clearly, again, crisis brings opportunity, and this is an opportunity. So on that note, I see lots of questions coming and lots of comments. And we have a great, really nice, engaged audience here. So Saurabh, I'll bounce it back to you. I know you've got some questions. Go for it.
Thank you, Paul. So while we have been having our own internal discussion, there are a lot of chats, messages, and some anecdotes that I'd like to share. But so first question is, I'm not picking the question in any order, but the ones that has not been covered so far. We need to think of insurance to all possible people. How do we do that? Is a question that was asked. Maybe I'll have Neeraj pick up the question for this one.
Saurabh, can you just repeat that question?
Yeah. So the question is that we need to think of insurance for all possible kind of wellness strategies. How do we do that?
Sure. And again, I think, so I'm not too sure in terms of if I get the right perspective of the question, but I guess the question is about how to make the insurance cover an entire holistic paradigm of employee health and wellness, rather than the bits and pieces today that we tend to cover in terms of employee benefits. A classic example, I think, when the COVID-19 situation broke out in India, a lot of organizations were left in a lurch, because majority of the health insurances excluded pandemics as a specific coverage. I know there was a huge rush in many organizations to make sure that COVID-19 related issues were covered by the insurance. A lot of negotiations, renegotiations which happened. And of course, bigger questions were raised at that point of time, that how do we cover and who do we cover? Is it only the employee? Is it the employee and the dependents? And who are the dependents? Is it only the wife and the child, or even the father, the mother, maybe the in-laws were staying together in a situation like this? So to give a short answer to this question, yes, I think HR managers across organizations have started understanding that insurance needs to be relooked in a very different manner. insurance needs to be thought about not only proactive facilities or platforms for employees, not reactive platforms and facilities for employees, but also the proactive ones, wherein employees are then encouraged to live, a much healthier life and leading to a much better work-life balance. So yes, there is a lot of scope in terms of not only in enhancing the overall insurance platform, but also thinking in terms of who and how it should be extended to from an employee's point.
Very valuable input. So Dr. Sanjay, I have a question for you. I have merged two questions together. Since vaccine is at the top of the mind of everyone, the questions are connected to vaccine. So first is, do we expect a second wave of COVID in India? So that's number one. And secondly, are people waiting and demanding for Covishield as compared to Covaxin? Is there a preference that in general Indian populace has?
Sure. I guess the answer to the first question is dependent on us. If we drop our guard, we will see a second wave. I guess the Indian population is a little more resistant because we've been used to infections. So we have a lot of cross-reactive antibodies already there. And that's why despite the large population, the kind of impact that the virus has caused in India is much less. But I guess it all depends on us. If we continue to keep our guard up, very less likely that we will have a second wave. And I don't think so. There has been a spurt. For example, in Mumbai, we have seen once, the local trains, the suburban trains that started, which is very difficult to avoid, the kind of close contact that you have. So I guess once people started getting back to work, once, offices opened, the restaurants have opened, I guess we just need to make sure that people keep their guard up. And that's the important thing. If we keep our guard up, I don't think we will see a second wave like it's seen maybe in the US or in Europe. So that's the first question. The second one, the Covishield is perhaps the more popular of the two vaccines. It's also the more widely available of the two vaccines. It's the one which has a technology transfer from AstraZeneca or the Oxford labs, and it is being manufactured with that same technology in India by Serum Institute. The Covaxin is manufactured. It's a fully indigenous vaccine, as I mentioned earlier. It's using the tried and tested live attenuated vaccine platform. It was given emergency approval. So if somebody is taking the Covaxin vaccine, they have to sign a consent form that they'll actually be part of the study. But I would encourage people that don't be too picky. I have family, friends, colleagues who have taken Covaxin. In fact, I've been trained at Grand Medical College and JJ Hospital, which is the government college, and that uses only Covaxin. So all the doctors, all the healthcare workers in that establishment have been vaccinated with Covaxin. So I don't think there should be a challenge, in which vaccine you take. In fact, I feel in the next 1 month or so, we will have the Russian vaccine Sputnik also available. We will also have perhaps, Pfizer or the Moderna vaccine. I think the Tata Group is trying to bring them to India. We'll also have the Johnson & Johnson vaccine, which is a single dose vaccine. So I think within the next 30 to 60 days, India will have a basket of vaccines to choose from. I feel, all vaccines are very effective in, preventing the severity of the COVID disease. Take whatever you get. If you do have a choice, I guess we'll reach that stage when, we have a little more data on, comparisons between them. But at this point of time, Covishield is the most widely available. But if you only have access to Covaxin, please go ahead and take it. Don't refuse that.
Great. Thank you, Dr. Sanjay. So don't drop your guard and go with whatever is available right now. It's all the same. Over to you, Paul. So I don't have a question for you, but more like a comment from someone. The comment is, together with technological change in adopting to telemedicine in India, there also has been a mindset change, which is phenomenal. Hope you agree. So more like a...
Yeah, I absolutely agree. And by the way, I don't claim to be an expert on India. I've been here for 4 years. and I'm all in. We have 75 offices across the country, so I've traveled the four corners of India. And I've also spent a lot of time in the smaller towns and also the outskirts, even way up to Ladakh, into the remote regions of Ladakh as well. So I've seen the, let's say, the continuum of India in terms of, let's say, culture and lifestyles and access to medical care as well. And I think the adoption of technology in India, if I compare to some of the other developed countries around the world, I was in Japan for almost 25 years. I can tell you that while Japan is a big exporter of technology, they're not a big adopter of technology in the day-to-day life, particularly in healthcare and even in, let's say, government-related functions and offices. So India, I think, has really shown agility. And I'm a big fan of agility in India. I think the Indian population and perhaps Indian culture as well is one of the most agile populations on the planet. And this whole crisis has only shown how India can move quickly, how India can be mobilized. If we look at this vaccination drive, and I'm sure Sanjay and Neeraj, you'd have a perspective on this, but again, I look at it from a global perspective. I talk to my colleagues in the Netherlands, in Germany, in France, and so on, and they're starving for vaccines. They can't get enough vaccines, and then the organization of the administration of the vaccine, actually doing the vaccine, is still challenging, still under construction. The same issue is happening in Canada. US is leading the way on sheer numbers and pace, but India is right close behind. And that's a remarkable, observation, and I would say comment and compliment about India and the agility. So I've seen a quick adoption of technology here, and I think that's a great thing. It's one of India's strengths, the agility, the ability to pivot when needed. I don't know, Sanjay, if you had any thoughts on what you've seen.
No, completely. In fact, since Paul, you and I have been speaking for a few months now, I know you like the word jugaad. I think you have almost understood the true meaning of the word jugaad. And I guess people from India, whether you like it or not, have to make do with jugaad. So I guess that's what it is. But I think adoption of technology definitely up there, and agility definitely up there. I think we are leading the way. As you said right in the beginning, exporting vaccines to so many people. I think we're doing a great job overall. I think it's a great coming together of the public and the private sector. I've seen that over the last 11 months in Maharashtra, where we've seen, the public sector or the government, coming closely with the private sector and working together. And I see that even during vaccinations. I got my vaccine at a municipal hospital, and I would say the facilities were top notch, extremely well managed. So again, I think, adoption, to a challenge and making that challenge into an opportunity. I think that's what India is all about, how to manage a challenge and convert it into an opportunity.
Yeah, well said. Thank you. And I see a comment in there that while I've called India, or my observation is India is agile, that maybe India is not as agile as one would think. But I think part of my definition of agility has been built on living and working in many, many countries, including Japan, as I mentioned, 20 plus years. I can tell you that India has the advantage when it comes to agility, having lived in Japan a long time. And I have a soft spot for Japan. It's in my blood, but it's a different league. We're going to pivot here away from, let's say, our agreed upon questions, gentlemen, because, hey, we're just over 1 hour and the rules change. And everyone in the audience, we would be 1 hour. We've gone a little bit over. So let me throw a bit of a, as you would say, googly or a curveball, as we'd say in Canada. A question for you both. Huh? No one has a crystal ball, and we don't expect anyone to predict the future. But I like to think, as I lead my team here in Randstad, India, we think of sunny, cloudy, and rainy scenarios in everything we do, right? Best case versus worst case, and somewhere in between. If you think about the sunny scenario, let's be optimistic for a moment. The sunny scenario as we move forward in dealing with this crisis, particularly within India. What do you see as the sunny scenario in the coming months?
You want me to start, or Neeraj, you would like to go first?
Sure, Neeraj, you can follow up.
Okay, so I'm very optimistic as an individual. I'm very optimistic as a healthcare professional, and I've seen, and I see good days ahead for all of us. From a healthcare professional, Paul, I would say the way I've been telling my team is that this is the decade of healthcare. It's not that we've entered into a new year, we've entered into a new decade. propelled by COVID. And I think we are only going to come out stronger in 2030. So I think from a healthcare perspective, things will only get better for all of us. It's been a rough ride, I know that, but I think 6 months and we should be, on completely sunny days after that, or definitely more sunny days. 6 months is what I would say. By maybe August, September, we would see a large number of people getting access to more vaccinations. People will have a lot more confidence, and I think life will slowly get back to normal by the second half of this year for sure. So I'm very optimistic, Paul.
So Dr. Sanjay, you're predicting that we will have Diwali parties then?
Absolutely. Unquestionably, I think we will have a happy Diwali. Well put.
Good. There you go. We all need a goal to work towards. Great. All right. And Neeraj, what are your thoughts on the sunny scenario?
Well, I would say that we are in the business of making of turning the gloomy scenarios into sunny scenarios. So we keep working on that. I think it's I'll take a leaf from our corporate governance. We are looking at the future on a quarter by quarter basis, not getting carried away or not getting too depressed by what's happening around us. And I think that's the advice I'd give to everybody. I mean, we spoke about not lowering our guard and continuing to showcase resilience. And I think that's how we should look at it. And if we do that, I think if the scenario even today is sunny. I mean, India just reported yesterday that we are out of the recession officially. What more can we ask for? I mean, I think we've really worked we have worked off our way through this crisis. And if we continue to be watchful, we continue to make sure that we showcase resilience. Hopefully we should be able to get on back to our Diwali parties. That's the hope.
I think we all agree. It's unanimous, even in the chat, in the comments. It's unanimous that we're all aiming for that important goal of a happy Diwali. All right. As we move towards closing, a question for you both as leaders, and I'll answer it as well after you. But lessons learned. I know it's tough to sum up what has been, for lack of a better term, a remarkable year in many ways. The lessons learned as a leader, just in maybe 1 to 2 minutes. Neeraj, you want to give it a shot?
Sure, and I think the good part is we covered quite a bit of this. But if I had to, probably take a look at the top two on my mind, and again, it's been reinforcement rather than I would say learnings. It's been reinforcements of the values and beliefs that I carry. One, of course, I think Sanjay mentioned it to the point, the first question which I answered, that is inclusive leadership. I always say lead from the front, stand with your employees and showcase empathy. That's the most important thing as a leader you can do, or you can contribute to a team, which ultimately, you take care of your people and they'll take care of you and the organization. So I think it's basically a reinforcement of my belief in this very fact that stand in the front, be with your employees, showcase empathy, and it's taken care of. I mean, any crisis you can easily overcome.
Thank you. Well said. Dr. Sanjay, lessons learned.
So I guess, as Neeraj said, we've covered a lot of them, and you mentioned about empathy and compassion, leading by example, purpose, agility, inclusive leadership. I think that sums it all. Like I said, I guess the biggest learning for me is everyone wants to contribute. And if you give people an opportunity, as Neeraj very correctly said, if you look after people, they will look after you. And I have a small story on this, if you can indulge me for 30 seconds. Right in the middle of the peak of the pandemic, when everything was in a lockdown situation, we used to have this guy who would come to our house to deliver eggs and bread. And he would come to the building and he would come door to door and sell us egg and bread. Now that is basic food, bread and eggs. Now, because of the lockdown, he was, obviously not allowed to come into the building. So people had to go down and maybe buy it from him. And he was supplying an area of around 6 buildings in our neighborhood. Now he came to me and he got to know that we do testing. And he said, "Can you help me?" I said, "Okay, how can I help you?" He said, I'm not allowed to enter any of the buildings because they fear I may be COVID positive. Now, this guy, Paul, you would be so proud to see him. When he would come to my house and I would see he's so fit, and I would ask him, what's the secret of your fitness? He's saying, I go to the gym after midnight every day. And because he says I have to work throughout the day, I go to the gym. And he showed me videos of him working out from midnight till 1 a.m., lifting weights, and he's like really fit. And I just connected with this guy right from day one. So I facilitated him for a simple COVID test for us. But for him, he carried that negative report and he was able to get back on his feet, start his own livelihood. But more importantly, he was able to provide eggs and bread to so many different houses. So I guess just the importance of being able to understand the challenges of people and how you can reach out to them in a simple way, and how that simple way can make a huge impact on society overall. So this story will remain with me forever, that just one simple test made a difference to, I don't know how many different houses. So I just felt, that I could share that with all of you.
Wonderful story. Thank you for sharing that. And then that will connect with my learnings. I mean, we've all had a lot. I look at leadership and effective leadership, impactful leadership as kind of a series of muscles. So what a great analogy to the gym. We build muscles as we go as leaders. And one of the muscles that we've all had to build was compassion. And I learned something very important of many, many lessons in the past year. I learned the difference between empathy and compassion. For a long time, leadership competencies, all of the organizations I know had empathy as one of those, right? Key qualities that you would measure of a leader. But when you actually look at the definition of empathy in the dictionary, it says that empathy is a response. It's a feeling in response to someone's situation, right? So you empathize with them. When in fact, compassion is action based on empathy. What a difference, huh? So what you showed there was compassion. You made a decision to take action, and your action made an impact. And I think this was a big revelation for me. Empathy is not enough. Empathy is not enough. We need to take compassion for action. So I leave everyone with that message. Look at opportunities to actually take compassion and turn it into action. All right.
Thank you. Thank you.
The final question, one more curveball. So people might not, I know Dr. Sanjay well. We've also gone on a learning journey together, coaching sessions with Marshall Goldsmith, Sanjay and I, on Saturday mornings. But Sanjay, something that most people on this call will not know about you. Well, this is Dr. Sanjay, founder of Suburban Diagnostics. He also wears another hat. He's a DJ, a very talented DJ. So Sanjay, I want to ask you this question. It's one of those classic questions we would ask each other maybe at a dinner party or something. One song. You can only listen to one song for the rest of your life. What song is it?
Wow. That's a tough one, Paul. That's a really tough one.
I told you, DJ Sanjay, I told you I was going to.
Yeah. So I have 5 songs that I call goosebump songs. That every time I listen to them, I get goosebumps. And I guess top of that list would be a song by a group called America. There's a song called Ventura Highway. And I would love for people to listen to it. So that's the English version of my top 1 song. And from Hindi, I would say listen to the soundtrack of the movie Andhi. It's got a great ensemble of, R.D. Burman, Lata Mangeshkar, Kishore Kumar, and Gulzar. Now that combination is again lethal. So the soundtrack of Andhi and Ventura Highway of America. These would be, I guess, my English and Hindi #1 songs.
Wonderful, wonderful. And now the chat box is lighting up big time, Sanjay, because everyone's happy to discover you're a DJ. And I'm even seeing songs like I Want to Break Free.
Free. By Queen. By Queen.
By Queen, that's right. Well, Neeraj, I can ask you the same question or another. You can choose from one or the other. Same question. Or there's one place. I can give you a plane ticket to go anywhere when it's safe. Where are you going?
That's a very interesting one. I've been missing travel so much. But I actually have promised. I have a 5-year-old, my daughter, who's very excited to go to Africa for a trip to see all the animals in the jungle. So yeah, if I could, I would actually take the trip to Africa, maybe a safe part where I could take her along and then get her out to a safari. We did try a couple of safaris in India, and that's where she got her passion from. But she's very excited to see a lion now and a couple of giraffes. So
wow, well, there you go. The goal has been set. Maybe by Dupuis or around Dupuis.
Maybe by December, yeah.
Yes.
And thank you, gentlemen. Saurabh, we can't let you off the hook. Okay, same question. You get a plane ticket. You can go anywhere tomorrow. It's safe. Where would you go?
I'd select Antarctica. I've always liked the snow-scaped landscape, and I love skiing. So yeah, that would be one place. But I don't know if I'm allowed to ski there or not. But yeah, definitely Antarctica.
Fantastic. Good stuff.
Nice.
Thank you all.
What about
Thank
you, Paul?
Huh?
Yes.
We can't let you go.
I can't leave you.
Oh, you're going to give
got to answer.
a ticket or a
You got
song?
to answer both. You got to answer both music
Okay.
and destination.
Okay. So there's one song, and I'm not sure how popular this band was in India, but it's a band called Journey. Steve Perry is the vocalist, just a
Absolutely.
voice. And they have a song called "Don't Stop Believing."
Don't stop believing.
Don't
Absolutely.
Stop Believing.
Amazing
I
song.
urge everyone to look for the song "Don't Stop Believing" by Journey and turn it up loud. It's the most amazing, inspiring song. I actually have been starting my day every day for 20 years now, without fail. I turn on that song. And India,
I love that song as well.
in India, I'm a big fan of Shah Rukh Khan and Chak De India. I like the movie Chak De India. Chak De India.
Nice.
Yeah. Thank you so much. And place to go, plane ticket? Wow. I mean, I love Europe. I love Rome and so on. But if you really ask me what's deep in my heart right now is Ladakh. I would love to go right back up to Ladakh and visit my friends in Ladakh. If I could, I would go tomorrow if I felt it was safe, but we'll get there eventually. Yeah? On that note, I want to thank you so much for this wonderful conversation. Everyone who's been listening and watching today. I'm going to pass it back to Saurabh to close it off.
Thank you, Paul. Thank you, everyone, for a wonderful session. I think for me, the biggest takeaway was this whole realization and reflection that yes, on one side we had the healthcare community come together and be part of this biggest worldwide change management exercise, and also lead from the front. I think that's something that has always stayed back with me, that yes, it gave us a higher purpose and something Dr. Sanjay spoke about. So on that note, and there's been a lot of insights that has come from this whole session, a lot of positivity that all of us can carry forward and look forward to as far as the country is concerned, as far as our well-being is concerned. So that's like another takeaway. On that note, I know that we have already exceeded the time, so I'll thank you all for joining the session. I hope it was wonderful for each one of you. And we look forward to be in touch with you, connect with you professionally, and keep the journey forward. Yeah.
Thank
Thanks,
you.
everyone.
Thank
Stay
you.
safe.